Okay, good afternoon. I'd like to call our meeting to order today, November the 9th, 2021 of the Pitt County Department of Social Services Board. And we always open our meeting by observing a minute of silent meditation or prayer, so we'll start our meeting that way. Okay, thank you. Public comment, Susan? Nobody's
sir.
here? Okay, thank you. So you have a copy of today's agenda. You've had an opportunity to review it. I don't know that we have any additions or revisions. Could I have a motion to approve, please?
So moved.
Second.
Thank you. All those in favor?
Aye.
Okay. Minutes from the previous meeting. You should have gotten a copy of those in your board packet, and hopefully you've had an opportunity to review those. And if there's no changes or additions, if I could have a motion to approve.
Move to approve.
Thank you, Dr. Bunch. And a second?
Second.
Thank you, Catherine. All those in favor?
Aye.
Okay. So first on our agenda today, moving forward, is recognition of new hires. And we have Dr. Augustine Frazier sitting in for Ms. Elliott today.
That's
And
correct.
He's gonna call your names and set the agenda a little bit.
Good afternoon. We have 3 new hires we are recognizing today. One is Trevora Jackson. She's not here. She's joining the legal department,
Okay?
but she's not here today.
Okay?
Amanda Keys, please stand up. Come to the podium. Just tell us a little bit about yourself. No pressure, though.
No pressure. This is supposed to be fun, Amanda.
You want me to leave my mask on? You want me to take it
It's
off?
up to you.
It's up to you.
So you can see my face.
Okay.
Thank you.
That's good.
I'm Amanda Keys. I'm new here. I've been here since October the 18th.
Okay?
I moved to North Carolina about 3.5 years ago from Mississippi. I'm a social worker where I've been doing social work for 13 years. I've done the majority of it in child welfare, probably 8 years. I've done mental health, behavior health as well. And I'm looking forward to my time here with Pitt County Department of Social Services.
Thank you, Amanda.
Welcome to the team.
Welcome.
What part of Mississippi?
A little small town called Taylorsville. It's about an hour from Hattiesburg and an hour from Jackson.
Okay.
So welcome. Thank you very much.
Thank you.
Our next new staff is Tashara Gaynor. Ms. Gaynor, please stand, and no pressure as well. Just tell us a little bit.
That's right. No pressure.
Yeah.
Good afternoon. My name is Tashara Gaynor. This is my second week here, so I'm still fresh. I'm still learning. I work in the Quality Improvement Unit at Department of Social Services. I've been in customer service for 17 plus years. I'm from Aurora, North Carolina, but I currently live in Greenville, and I'm just thankful to be a part of the team.
Welcome on board.
Thank you very much. Welcome.
We want to recognize a 20-year of service to the agency. Mr. Stuart Goodson, please stand. You are duly recognized through the chair, and thank you for your hard work and your perseverance and all you do for the agency. Mr. Stewart was presented with his gift by the county manager.
How many years of service?
20.
20 years of service.
Excellent.
Thank you very much.
Thank you.
That's all for that agenda, Mr. Chair.
Okay, thank you. Okay, items for report. We're going to move in here, and we're going to hear about the LINKS program. You know, we had talked about that, the trip that the LINKS program had taken a couple months ago. That was on our board agenda, and we had asked Ms. Jan to give us an update and report. So those of you that are going to report, come to the podium and let's hear about it.
Hello, I'm Chandra Reborn, Social Work Supervisor. I supervise the LINKS program. This is one of our 18 to 21 participants, Mr. Dylan Neese.
Welcome,
And
Dylan.
he took a part of that trip. I also have a statement from Miss Abigail Jones, who was another one of the participants who couldn't be here today due to her work schedule. But she sent me an email and she asked me to read her experience to the board. So I'm going to read hers and then I'm going to let Dylan tell us about his experience. The children went to the Daniels Memorial Conference in Orlando, Florida back in September, and the name of the conference was Growing Pains 2021. Abigail says that it gave her a lot of insight about just how many roles people play within successful, independent living among youth in the system. Getting to know people from all over the United States and even some out of the United States was very interesting to her. Since the connection with social interactions since COVID began had been so rare, this was an amazing opportunity. Getting to hear from former foster youth, social workers, state workers, professors, and published authors was a very unique experience. Many sharing similar views. For example, the trauma impact of COVID has been a trauma for many people in the world. This opened me up to the idea to other people that just because someone's trauma isn't as bad as yours doesn't mean that comparing it makes it any less traumatic to the individual. Everyone reacts differently to various situations. This conference also taught me that teamwork and connections can take you a very long way. Getting to meet other youth and being able to talk about our experiences with other people was great. Talking to a social worker is okay, but they haven't lived in the system and they may never understand to the degree that what your peers understand. Another thing we covered in the groups was self-care. A lot of times, foster youth, we don't quite know what it looks like to take care of ourselves. So we begin to talk about making schedules and sitting out times for ourselves to just enjoy and take care of ourselves. I am very thankful to have been able to attend this conference, and I hope that many more foster youth will have the same experiences I did. Thank you, Abigail Jones. So now I'm going to let Dylan
That was
talk
very
about
nice.
his experience.
Good afternoon. First of all, I'd like to say thank you to the board for letting us speak here today. To kind of give an introduction to myself, my name is Dylan Neese. I've been in the foster care system since I was 16 years old, after the passing of my mother. To kind of start out, touch on what my colleague Abigail said, a lot of people in the system don't quite understand what it's like to be a foster youth. So to go to a conference to where there's other youth that have been in the system, whether it be recent or in the past, it's completely refreshing to hear their point of view on everything. Another topic that was brought up a lot was how to take care of yourself through college, how to maintain a home and everything like that. Right after the passing of my mom, my foster family assisted me in renovating my house. So right after I turned 18, I became a homeowner, which was completely different than anything I was used to. So learning life skills like those was extremely important for me, being fresh out the gate and going to college full-time as well. It assisted me in trying to figure out what my schedule for college is going to look like and figuring out different study patterns, everything else, and it was just a tremendous experience all around that was extremely helpful in every way. So lastly, I'd just like to thank the board one more time for allowing us to go and hopefully allowing youth in the future to go. So thank you.
Thank you.
I really appreciate that. I think as a board, we need to remember those next year, and maybe that helps us in terms of making decisions. I think both of those were wonderful testimonials. I appreciate that. Thank you.
Thank you.
Okay. Thank you again. So next on our agenda is Brian's going to talk to us about the holiday cheers. No, we're going to hear again about holiday cheers. That's right. Thank you, Dr. Berger.
That's my job.
That's right. Keep me straight.
Okay, so I'm here to talk about holiday cheer. So a very merry foster care Christmas. Holiday cheer 2021 with Pitt County DSS. So I will start by saying that we don't have any federal, state, or county funds dedicated to provide Christmas to the children that we have custody of. So the Pitt County Department of Social Services is starting to make Christmas plans for the foster children whom we have legal custody. We must rely on donations from generous citizens like you to be sure that each of these children will receive a visit from Santa and have a happy holiday. You can help by providing financial donations, sponsoring a child by purchasing items off their wish list, and purchasing new toys or clothing items. Currently, we have over 160 children in the foster care system, ages 0 to 18. We're going to ask that you please help us reach our goal by sponsoring a child during the holiday season. All donations and contributions can be sent here to the Pitt County Department of Social Services, 1717 West 5th Street, Attention Foster Care Special Needs, and Holiday Funds. If you need more information or specific information to a specific child or age group, you can contact me, Chandra Mewborn, at 252-902-1244. And I will just say we do have that 18 to 21 population that Dylan is in. We have about 25 of those children. We are also trying to do a push to help those children with Christmas. They do get a stipend, but most of them are in independent living. And so the stipend that they get, they need it to pay things like car insurance, rent, or car payments. So anything that we can do to help the 18 to 21 population, as Dylan said, some of them are college students. They may need something like a set of pots, an iron, or ironing boards, everyday things that we have in our household. That population of children are in need too. So we're just asking everybody to partner with us. We cannot do it without the community. And we just want to thank you for sharing the true meaning of giving with our children during the holidays. Thank you.
Thank you very
Thank you.
much. You were doing double duty today.
Yes, sir.
Okay, now we're going to hear about the Adult Services Christmas Cheer Initiative.
Good afternoon. I'm Tammy Corbett, and this is Jennifer Stroud, and we coordinate and carry out the Adult Foster Holiday Project. So we are approaching that time of year. As we are pondering our own plans for the holiday season, we do ask that you remember the elderly and disabled individuals who are in our residential facilities. Many of the elderly and disabled individuals living in these facilities receive as little as $66 a month to purchase medications, clothing, personal items, and many of these individuals do not have family or any loved ones to help provide these items to them. Also, Pitt County DSS is also legally responsible for numerous individuals age 18 and up who also reside in these residential care facilities. Many of these individuals also do not have supportive family or anyone to help them out, and also receive limited income. So our agency relies greatly on the community for support in helping assist these individuals with items that they need while in these facilities. Once the holiday season has passed, any items that we have left over or any monetary donations that were received that are left over, we use those to replenish the supply of hygiene items and personal items and clothing and medical supplies, any unmet needs that these individuals have in facilities. This goes on all throughout the year. Anything left over, we use that to fill in for anything that they need and don't have the funds to purchase them. So what you can do to help, I'll let Jennifer go over how you can help us out.
So you can purchase some general items, hygiene items, things that we take for granted, deodorant, body wash, socks, underwear, anything like that. You can coordinate some kind of hygiene drive with your families or your friends or community groups. We utilize those, through the holiday season as well as throughout the year for individuals, that are needing those things that we take for granted, like buying some Dove body wash, that might be $5, might be too much for them. You can also sponsor an individual. We have wish lists for individuals in facilities that we can provide you with, or you can provide a monetary donation, and we'll make sure to get those wish lists fulfilled and to the facilities, to those individuals. Any monetary donations can be made to the Pitt County Department of Social Services, Attention Adult Foster Care. And you can also contact myself, Jennifer Stroud, Tammy Corbett, or our supervisor, Janet Van Honk, about our holiday project. That's it.
Very good. Any
Yes.
questions?
Thank
I
you.
have a question. With the socks, are they special kind of socks, like the no skid socks, or just regular socks?
It can be regular socks, you know, it can be some with the no skids. A lot of folks wear them with, you know, their tennis shoes, just different kinds of socks, crew socks, sometimes diabetic socks, those types of things.
Okay.
So has your drive started? I mean, is this early, or
No, we've jumped in.
have you jumped in? Okay, that was my question.
We're
So it's
still.
not too early to help?
It's not too early. We've received the names of individuals who need the help. We're still getting more names in. I think we are expecting to serve around 150 individuals this year. So we're sending lists out to people. People are calling, can you send me a list? Can you send me 10 lists?
Good.
What do you need? So yeah, we're deep in it.
Well, we appreciate that. We appreciate what you do.
Thank you.
Thank you. Okay, now, Mr. Bryan.
Good afternoon. The Low-Income Energy Assistance Program is an annual program which assists low-income households with heating expenses. The application period for this program will begin December 1st and run through March 31st. There is a priority group for applications taken in December, and the priority group for applications taken in December is any household with an individual age 60 or over, or a household member who is receiving a service from the Division of Aging and Adult Services due to disability. Anybody that does not have a household member that falls in the priority group may begin applying in January. And those that are in the priority group, they have the whole period to apply as well. They can apply the whole period that the program operates, but we encourage those in the priority group to go ahead and apply in December if possible. There are several ways to apply. If an individual wants to fill out a paper application, they can do that in person at our Human Services Center at 203 Government Circle. But applications may be made by telephone and also through our online application portal. And that online application portal is a portal that is used for food and nutrition services and Medicaid applications, as well as crisis intervention program or emergency assistance applications for heating or cooling. And the website address is epass.nc.gov. We will be providing all of this information when we do our press release later in November. Now, we'll have to mention that last year, people that had received previously in the priority group received automated payments. There was additional funding received, the pandemic LEAP funding that was received, and those automatic payments were done. We still do not have word whether any automated payments are being made, so at this point, we just encourage anybody in the priority group to go ahead and make an application in December. If there is some other instruction, the client will be notified by mail if an automated payment is going to be made. So absent of getting a notice indicating that you are receiving an automated payment, it would be best to go ahead and apply starting in December. We will update our instructions when the press release goes out later in November, and all of this information will be included at that time. And I'd be happy to answer any questions you have about the program.
Brian, when you say automated payment, exactly what does that mean?
Well, last year, anybody who had received in the priority group the previous year, the state was able to run a report, and those people, if they were also receiving food and nutrition services benefits, meaning they met the categorical eligibility requirement for LEAP also, the payment was made directly to their vendor without their having to make an application.
Without an application.
And that's why I'm mentioning that this year that may not happen. We're still waiting on instructions for that. So that's why we're encouraging people by December. You know, we will definitely know by then. And if you call the agency, we'll be able to tell you. But the press release will indicate the instructions for making application.
Sure. And another question, I'm just curious. Have you
Yes.
always had the online application?
The online application was new this previous fiscal year.
Okay.
They opened the portal in January of the previous fiscal year. But the portal is open now for December applications as well. That was the premiere of being able to accept applications, and a lot of people utilized
Good,
it.
that was my next
A lot
question.
of people utilized it. You can do it from home. Anywhere you have computer access, you can go ahead and do it online. And we do have to conduct an interview. But the interview, we ask that clients please give us a good telephone number. We'll do the interview by phone.
That's wonderful, yeah.
And it
that's
worked
good.
very well.
Good. That's a good approach. Thank you. Any other questions for Brian?
No.
Okay, thank you.
Thank you.
Uh-huh. Okay. Thank you, Brian. We're going to hear from Mr. Dancy and Dr. Bunch regarding our director search. And just reminding folks you're representing the board in this process. And so go ahead and update us.
So as a society, we are continuing to experience a number of unforeseen issues, including COVID variants and emergency rescue plans that have caused us to conduct business differently. So we wanted to give ourselves more time to expand our search. It is the search panel's recommendation that the director's position be extended 30 days in order to expand our search.
Okay. So the recommendation is to continue for additional 30 days?
Yes.
Okay. Any questions for Dr. Bunch and Mr. Dancy? So that is a motion that we do that?
Yes.
Okay, so could I hear a second to that? Second. So all those in favor of continuing the search for an additional 30 days, and we'll have to look at, in terms of the timetable, in terms of how we do that, in terms of when that's going to be run.
Yes.
But once we do that, the motion would be to continue the search for an additional 30 days.
Correct.
Okay. So I have it's been motioned, it's been second. All those in favor say aye.
Aye.
Aye. All those opposed, nay. So, okay, thank you. Okay, I guess that I'm up here. I just wanted to remind and talk a little bit about the North Carolina Board Association, and I actually represent Pitt County along with 4 other counties. It's the North Carolina Association of County Boards of Social Services. And actually, Pitt County's in Region 4, and I am the director for District 11, which includes Pitt, Martin, Edgecombe, Nash, Wake, and Wilson County. So we meet on a quarterly basis. We had our last meeting October the 22nd. So this is just a little bit of an update in terms of the activity of that board. I want to remind everybody that we do have the board training coming up, and that is going to be November the 16th and 17th. And I think that everybody on this board is registered for that.
Yes.
remind you that at this point, it's highly encouraged. I think very soon going forward, it'll be a mandatory annual training, that board members receive annual training on their responsibilities. And Amy Wall will be doing the training, and Amy has done this multiple times. And you know, the annual meeting that Social Services has in the fall, she historically has done the board training for the DSS board members of that training. So I look forward for that training and encourage everybody to participate. It's going to be good. The other thing I want to mention is that historically the association has connected with the DSS association in their annual meeting. And the board association has run a parallel meeting during that time and taken that opportunity to meet. Because of COVID, there's not been that meeting the last couple years. So the board association is working to pull together an annual meeting, and we're looking tentatively at March the 18th. This coming March the 18th. That was just decided at our meeting last month. They're looking at locations. Again, that's a tentative time. Just to let you know, there are 81 counties out of the 100 counties that participate in this association. So the thinking is for those participating counties, this activity, and county board members, this activity will be free. There'll be a small fee for those individuals, board members that want to attend, that their counties are not members of this association. So those were the two big things that we talked about. The hope is that next year, when things, if the DSS Directors Association has their annual meeting, we can connect again with them. So this potentially just could be a one-year thing. I've encouraged the board up there to do a save the date to get the word out early so people could go ahead and plan for this. They were looking at locations both in the Triangle area and maybe in Greensboro to host this. So anyway, that's more information for that to come. But I wanted to just make people aware of that. So those were the big items that came out of that meeting. So any questions about that? Okay. And now we're going to move forward with Dr. Augustine Frazier's report, the Deputy Director's report, and he's going to talk us about the grant, and I was pleased to see there's been quite a bit of movement in that.
Do you want me to go to the podium or stay here?
Your pleasure.
Your call.
You're fine with here.
Okay. So I will give you reports on the Medicaid transformation. DHHS has dedicated 10 lines to the 10 major languages so that they can have direct access to brokers and enrollment counselors to eliminate any communication barriers. That has also been a problem that we have experienced with the language line, but this is now no longer a problem. That has been resolved. So the next big thing that is looming around is the Taylor plan that is supposed to cue in on July 2022. And currently it is on track to meet that deadline. What has happened is there is a lax in the billing process for outpatient during this transformation. So there is now an agreement that they can still lax it because of the COVID so that clients will continue to get services uninterrupted and still providers will be able to bill. And that billing has been called to order and it is now in process. And also the enrollment brokers can change your plan with cause. Let us say you are sick in the hospital and you are not able to do your changes by November 30. That is a good cause which will utilize and allow this transformation to be changed by the brokers. So that is all about the transformation. Any questions? CDBG. I am happy to report we have seen the excitement on this program that we are anticipating. There has been close to about 150% increase for requests just for last month, and a total of 192 residents have participated and benefited from this program. As of today, or yesterday, we have 91 people who have been approved for the utility portion for a total of $40,504. We have 37 applications that are pending for review or waiting for documentation. We have found out that people do not have the document to support some of these bills that they have said they have. Even though the utility companies have them, but the tenants do not. So we are trying to see if we can get those directly from the utility companies, but it's becoming a toggle, and we are still stuck at that. Hopefully that will be resolved, and people will be able to benefit from this program. Any questions on the utility portion?
So people could also, I'm just thinking of, could this is COVID-related funding?
Correct.
So the LEOP program, that could possibly, they could work together in terms of, there would be no issue in people receiving both of those funding.
Correct.
Right.
It's separate.
Separate.
It's not the same bucket.
Yep.
Rental assistance. This has also been an interesting case. Even though we have a lot of competitors around the Pitt County area, we have seen an increase in the interest of this program. Last month, we have 43 candidates, people who applied for this position, for the program. 4 of those were approved for a total of $7,914. 18 applicants are pending review and waiting for documentation. Here again, we have some problems. Most of the people do not have leases or justification on how they can justify the amount that they owe. So we are still looking at ways where we can leverage some of these nuances so that they can qualify. We are currently talking with the Department of Commerce to see how they can lax some of those rules. Any questions on the rental assistant?
Questions for Dr. Frazier?
I did want to clarify something, Dr. Frazier. So you're saying with utility assistance, the utility companies have those bills, previous bills, so they know,
Correct.
okay. But the
The
tenant,
tenants don't have it.
the tenants don't have it, so they have to, okay.
Correct.
And Dr. Frazier, remind us, you hired, there was additional staff hired to
Yes,
to
we
work this
had
work?
2 or 3.
We hired 2.
So,
That are
true,
work- that are
to
working.
help with this, yes.
Good.
Okay. So I will move on to the director's report. Ms. Jan is not here. I'm representing her. I'm happy to report on her behalf that the agency is meeting the timeliness of Medicaid application. We made it up to 90%, and that's kudos to that team. And I am very happy to say they have done very well considering the amount of work they have to meet for the timeliness application. However, for the average Medicaid application processing time, we are a little under the weather. We are not making that benchmark. We are seeing some progress, but some of the cases are complex that is causing us not to meet the timeliness. That's for the Medicaid application processing report. Any questions on that?
I don't.
Agency vacancy report. Currently, we have a total of 27 vacancies in the agency. 7 were filled as of last meeting. 1 is frozen, 5 going through interviews, 10 advertising. 4 of those are going through the background checks, have already gone, we are waiting for the report, and 7 are now in the screening phase. That is a big step, and that's a huge, significant help that we can hope for in the coming months to make sure we meet the timeliness and increase services to the people of Pitt County.
Questions for Dr. Frazier representing Jan? Any questions? Okay, thank you.
Thank you.
Thank you for those reports, Dr. Frazier. Okay, so director's report, moving on to the last agenda item, and it would be board member comments. Anybody have any comments for today?
I'd just like to encourage the community to get involved with Christmas cheer for children and adults here in Pitt County, and to say congratulations to the new employees and congratulations to the gentleman who has been working here. Is it 20 years?
20 years.
Yeah. Congratulations.
Yes.
Thank you.
Others?
Good.
Okay.
I would just like to say I was really impressed with the Lynx presentation, so that was a
Absolutely.
good shout out. That's a good deal, so good job on that.
Yeah, as I said, it would be nice to get a transcript of those testimonials in terms of kids. So I know that we talked about every year that comes before us, but I think that would be a good memory as we look to approve that next year. So anyway, okay, if there's no other board member comments, I will ask for a motion to adjourn.
So moved.
Catherine, in a second.
Second.
Mr. Dancy, all those in favor, say aye.
Aye. Oh.
Oh, somebody had to say that. Somebody had to say that.
Aye.